The only thing you're really not going to palpate is the glenoid. You can get the superior angle, you can obviously get the spine, and you can follow it all the way around to the acromion. And then, just because you really like your partners, you're going to palpate their core part process. Did you guys do that in intro? It's not very fun. But if you do it right, it's a very, very important structure to palpate. And then following the clavicle, pretty much all the way from the acromioclavicular joint all the way to the sternoclavicular joint. And then once you get to the sternoclavicular joint, just wasn't a sternum in there, you can palpate pretty much the entire sternum, the manubrium, the body, all the way down to the xiphoid process. Okay? So, I need a model. Somebody, anybody, look up here. Don't be shy. Come on, somebody. I'm here. Somebody. Okay. Palpation position when you're talking about bones and ligaments is pretty much user dependent. So there's not a standard way that you need to palpate. You just need to be, in anything that you do with your patient, you need to have good body mechanics as well as your patient needs to have good body mechanics, and they need to be safe. So we unfortunately don't have tables that rise up and down. So sometimes I'll switch how I have my patient for my comfort level because I'm so tall. So you guys, I'll show you in different positions, but just because I do one position doesn't necessarily mean you have to do in that position. There are certain things that I'll say, this is the one and only way you can do this. Then that is the one and only way you can do it. But most things are pretty flexible. If you feel like, man, I just can palpate a whole lot better with her laying down, have her lay down. So that is not a standard. Just because I show it in one way, if you feel like you can get it better in a different way, go for it. As long as you're safe and your patient's safe, I'm totally okay with that. Okay? Just for visual, I am going to have you lay down. Just so I'm not standing in the way and everybody can see. And if you can't see, get up. Okay. Okay, so a big thing when you're working with your patients, and I'm sure Dr. Franco has taught you guys about this, but when you do your comps and then anytime thereafter, I mean, we drill it into your head for every comp from now till you're finished, that there's these beginning things that you absolutely, absolutely have to do to communicate and be safe with your patient. The first thing is introducing yourself. So regardless of what I'm going to do with my patient today, I'm going to come up and go, hey, my name's Susan. I'm going to say I'm your physical therapist. All of you are going to say I am your student physical therapist assistant. So if I was one of you, the very, very first thing I'm going to do is wash my hands. You can do that with the hand sanitizer, or you can do it with soap and water. Totally up to you. So that's like rule number 1, wash your hands. Rule number 2, introduce yourself. So let me just go through the whole spiel. So here's what I do. So this is comp scenario, basically. So I want to wash my hands, and this is a good time, speaking of the comp specifically, for you to kind of like get your thoughts together. So I'm going to hand you a piece of paper that has your muscles on it and all the things that you have to palpate and all the things that you do, and you have a minute to look at that paper and like not throw up. Because if you've used this hand sanitizer, even with a little hooky thing on it, it still gives you like a gallon of hand sanitizer. So it's like, I can sanitize my whole body while I'm waiting for it to dry. Okay. And then I'm probably going to, my patient might be standing up when we do the next part. It doesn't matter. But just because I already have her laying down, I'm going to have her stay here. So then I'm going to come up and I'm going to go, hey, I'm Susan. I'm going to be your student physical therapist assistant today. Before we get started, I need to make sure that I know that you are the right patient that I'm supposed to be treating. Patient identifiers. Because medical liability these days is skyrocketing because people treat the wrong people. Scary, but sad, but true. So, your job is to make sure you know who your patient is. So you say, can you please give me your full name and date of birth, please?
Co-virus 415.
Okay, and then I would like fake that I was looking at either her ID bracelet or her chart or whatever. Because in the real world, that's what you would do. Because I could go out and have a John Smith, and maybe there's 5 John Smiths. I don't know that. Especially, it happens more in a hospital. An outpatient, like you see your patients like 2 or 3 times a week. They really get sick of you asking So then they start making a joke. They're like, it's Santa Claus. I'm like, I know, I just have to do it. Just bear with me. Tell me what your name is. So, but an inpatient, I mean, people change rooms all the time. And so you go in and think you're treating somebody, and that might be the first time you treat them. And you just assume because they told you they were in room 123, bed B, that was the right person. And somewhere they switched, and you didn't check. So make sure you check patient identifiers. It seems really silly, but I guarantee you half of medical malpractice these days is treating the wrong person. And that can have in physical therapy, I mean, hopefully it wouldn't have huge deleterious effects, but just don't do it. But in medical in general, it can have like life or death situations. So treating the wrong person. So make sure you ask the patient who they are. So I'm going to wash my hands. I'm going to introduce myself. I'm going to ask the patient who they are. And then there's some other things they're going to fill in there, like gait belts and positioning and that kind of stuff, depending on what comp we do. And we'll talk about those as we continue to go on. But before I even do any kind of palpation, I'm going to say, okay, what we're going to do today is going to require me to place my hands on you. So don't use the word touch. It kind of has this like weird, you know, people kind of feel kind of funky, like you're going to touch me. That's like, nah, not a good word to use. Don't use it. Say I'm going to have to place my hands on you in whatever area you have to be treating. So today we're going to I'm going to place my hands through here and then around your shoulder and back on kind of the back part of your back. You okay with that? So you have to get permission. If you are in sensitive areas, if I'm going to go down the middle of her sternum, I'm going to ask again as I go there. You know, you're up in people's business. You want to make sure that I double check that. If in the real world there's any doubt, especially if it's like a male-female situation, an opposite sex situation, and you're concerned, bring in another staff member. Attack somebody. Just have another set of eyes, another set of ears, CYA kind of thing. As sad as it is, anybody can sue anybody. And I can tell you from experience, I've been sued. It sucks. I never did anything wrong, but that doesn't mean somebody can't sue you. It just so happened that I was working for Lakeland Regional at the time. They weren't going for me. They were going for Lakeland Regional money. And Lakeland Regional has attorneys that are very, very good and do their job well. They were just completely full of it. But going through the process sucked. Like, you don't sleep, you don't eat. It's very, very stressful. So the more you can cover yourself, the better. If you even have the slightest inclination that something's not right, cover yourself. So if you have a patient that you just, you know what, and we're going to be working in that pec area and you're a guy and it's a female, bring another set of eyes and ears in there just to make sure there's no question, because if somebody sued you, it's a he said, she said thing. If I have another set of eyes, now all of a sudden it's not. Okay? So that's kind of a bummer what we do, but it has to be talked about because it really is important. I love my job. I would not do my job because of that risk, but the risk is out there and nobody can stop anybody from suing. And people are crazy and they try to sue because they want money, and it's just not cool. But the more you can cover yourself and do the right thing, the less chance there is. Okay, so I'm putting down on today, I'm sorry. Okay, so I have to place my hands on you. So that's the verbiage you want to use. You don't want to say touch, you want to say palpate. Palpate, I don't really know what that is. Touch is a bad term.